Good afternoon, and welcome to today's webinar on the Family Home Health Aide opportunity. We are excited to share how you can become certified and get paid to care for your medically fragile child. Before we begin, please do not record this presentation. We want everyone to engage fully, and we will provide follow-up information. If you have questions, please use the raise hand feature or the chat. We'll have a Q&A session at the end. This webinar will cover program eligibility, training, certification, and the steps to get started. Our goal is to support families like yours with financial assistance and professional training to ensure the best care for your child. Let's begin by introducing Greater Vision Healthcare Services and why we are committed to supporting caregivers like you. At Greater Vision, we are committed to providing high-quality care for those in need. Our services include 24-hour pediatric nursing care, home health aide support, life skills development, and homemaker or companion care. These services work together to enhance the quality of life for individuals requiring daily assistance. Greater Vision Healthcare Services has a strong history of providing exceptional care. In 2018, we established our home health agency, serving Orange, Osceola, Seminole, and Brevard counties. By 2019, we achieved CHAP accreditation, ensuring we met the highest standards of healthcare services. In 2020, we expanded to provide private duty nursing and non-skilled services to over 30 pediatric clients in Central Florida. Today, we continue to grow, serving both pediatric and geriatric clients while expanding into Medicare services.
When I was just a boy, still out alive.
Now let me tell you about our CEO and founder. Greater Vision is a minority and woman-owned business with a proven track record of success. The first Greater Vision company was founded in 2016 by Siobhan Stallworth, who owns and operates subsidiary companies in the healthcare and service industries. She is a practicing nurse by trade and also provides dedicated services to our patients as well. Greater Vision cares about the community, and we love to host several community events throughout the year. We have a Client of the Month program where we honor a client each month with a special day and activities.
Your stories, I believe you'd never lie. And I believed if I could climb the trees behind the house, I'd touch the sky.
We had our third annual Back to School Bash where we partnered with the City of Ocoee and we provided backpacks, school supplies, and food. We provided clothing and supplies to a local Mothers-to-Be organization. We also had our third annual toy drive where we provided toys and fun to our local children.
Before we continue, we'd love to stay connected with you. Scan the QR code on your screen to follow Greater Vision Healthcare Services on social media. Stay updated on our programs, community events, and opportunities to get involved and share it with your friends. Next, let's dive into how this program works and how you can get started. This program is created to decrease the hospitalization and institutionalization of medically fragile children, reduce state expenditures, and provide an opportunity for a family caregiver to receive training and gainful employment. To participate in the Family Home Health Aide program, the pediatric client must be receiving private duty nursing services ordered by a physician and also receiving home health services through Greater Vision. The health plan must authorize the services in advance. This program allows family caregivers to provide care at home, which can reduce the number of private duty nursing hours needed. This model ensures the child receives the care they need, while also making it more cost-effective for the family and healthcare provider. Let's take a look at example 1. For a client with orders for 24-hour nursing, that adds up to 168 hours per week. Typically, the agency provides around-the-clock nursing. However, there may be times when a regularly scheduled nurse is on vacation and the family prefers not to introduce a new nurse for just a short period. In this case, if a family member is already cleared to work as a family HHA through Greater Vision, they can step in to cover the open shifts working up to 8 hours per day. For example, they might cover 7 p.m. to 3 a.m. The agency may then adjust the other nursing staff schedules to cover the remaining 3 a.m. to 7 a.m. shift. If coverage isn't available, that time would go unstaffed and be reported as a missed visit. Now, let's look at example 2. In this case, the client has nursing orders for 8 hours per day, 6 days a week. The patient's mom becomes a family HHA and is able to work the Saturday shift, allowing her to care for her loved one while she's already at home with family. A related provider refers to any direct relative of a client receiving services. This includes parents, siblings, grandparents, or other immediate family members who are directly involved in providing care. These family members can participate in the Family Home Health Aide program, allowing them to be trained, certified, and compensated for providing care to their loved one. This ensures that family caregivers can be financially supported while continuing to provide the high level of care their child or relative needs at home. This program is designed for family members who are already providing daily care for a medically fragile child. To be eligible, applicants must be at least 18 years old and physically able to perform caregiving duties. They must pass a level 2 background check, complete a tuberculosis test, and be able to read and write in English. All applicants must successfully complete training provided by Greater Vision and, once hired, they will work as employees of our agency, following all company policies and procedures. We understand that some of these requirements, such as the Level 2 background check, CPR certification, and tuberculosis test, come with a cost. However, we don't want financial barriers to prevent you from starting this journey. If you need assistance covering these costs up front, speak with our recruiter. We can explore options like payroll deduction to make it easier for you to get started. Your commitment to providing care for your loved one is what matters most, and we're here to support you every step of the way. Our training program ensures that all family home health aides are well prepared for their role. It includes at least 40 hours of theoretical nursing instruction, a minimum of 20 hours of hands-on skills training, and at least 16 hours of clinical training under direct supervision. In addition, caregivers will be trained in documentation, company policies, infection control, and CPR certification. Theoretical training is conducted online, while hands-on training takes place in person at our office or in a home setting. Additionally, if you've already completed any relevant training elsewhere, we encourage you to submit proof of those certifications or credit hours to our HR department. If you have completed courses towards CNA licensure or other nursing-related training, we can review and potentially give you credit for that training. This could reduce the amount of training you need to complete with Greater Vision and help you get started sooner. Please make sure to submit any relevant documentation so we can give you the proper credit for your prior learning. We understand that many of you are likely already working elsewhere and balancing family responsibilities. That's why we're committed to working with you where you are. Whether it's in the office or at the client's home, our compliance director and director of nursing are available to provide the support and hands-on training you need. We'll help you with test prep and assistance to ensure you pass the state-approved exam and complete the required skills validations. You'll also receive an overview of the mandatory skills and practical application needed to feel confident and prepared in your new role. At Greater Vision, we have seen firsthand how caring for a medically fragile child can lead to a lifelong passion for healthcare. For many parents and family members of special needs children, it's common to take that experience and turn it into a career, going back to school to earn a nursing degree or other healthcare certifications. In fact, we have nurses on staff who have been with us since 2017, when we were initially caring for their children. Their dedication, firsthand experience, and deep understanding of patient care make them an invaluable part of our team.
At Greater Vision Healthcare Services, we provide healthcare and education with a spirit of excellence. We are a home healthcare and staffing agency serving Orange, Osceola, Seminole, and Brevard counties.
I like the hands-on part. I'm a hands-on individual, so that is helping me.
It's been really good. experience for me. Very educational if you haven't done some of these skills in a while.
At Greater Vision, we offer elite nursing care for your children and also provide skilled nursing, home health care aides, therapy services, and companion care for loved ones of all ages.
Greater Vision always have an answer. You guys not the only agency I work for. I work for a lot of agencies, but Greater Vision is different in all kind of way. You guys have staff. When you call anytime, anything you ask, anything, any phone call you make, with Greater Vision, you will get an answer. You guys really doing good, and I like it.
So, how I feel about Greater Vision? Well, I've been with them for about 2 or 3 years now, and I like the fact that I have nursing coverage, and they're able to accommodate me and my kids' needs. I'm especially happy with the new things that they're bringing to the table, such as Client of the Month. There have been like a bunch of changes throughout the years, and I'm just excited to see how the company is growing.
Let's take a moment to highlight the benefits of becoming a family home health aide with Greater Vision. First and foremost, this program allows you to be compensated for the invaluable care you're already providing for your loved one. This means you'll receive financial support while staying at home and caring for your child, without the need to take on additional jobs. We also offer flexible training to accommodate your schedule, knowing that you're likely balancing other responsibilities. Our team works with you to ensure you receive the training you need at a pace that fits your life. In addition, you'll gain new skills that are transferable to other roles within healthcare, opening up future career opportunities. You'll also receive certification that adds value to your professional profile. Finally, we are here to support you every step of the way. Our team, including the Compliance Director and Director of Nursing, will ensure that you have the tools and guidance you need to succeed in this important role. This program is a wonderful opportunity to gain financial support, build your skills, and make a real difference in the life of your loved one. Becoming a family home health aide is a straightforward process. The first step is to complete the online application and eligibility verification. Once approved, caregivers go through the intake and admission process, followed by signing the employment offer letter. Next, they complete CPR certification and tuberculosis testing, then undergo fingerprinting and background clearance. After attending the required training and orientation, they must pass the state-approved test and skills validation. Once service authorization is received, they can begin providing care, documenting their services, and receiving payment. While this program offers many benefits, there are some important limitations to keep in mind. Family home health aides can provide a maximum of 8 hours of care per day. The child receiving care must be Medicaid eligible. If a parent is close to the Medicaid income threshold, they may need to select another family member, such as an aunt, uncle, or grandparent, to serve as the caregiver in order to maintain eligibility. Now that you have all the information, it's time to take the next step. To get started, simply scan the QR code on your screen or go to gvhcs.com to complete your application through ADP. You can also find the link in the chat. Once your application is submitted, our recruiter will contact you to guide you through the next steps and get you started on your journey to becoming a family home health aide. We look forward to working with you. We know you may have questions, and we're here to help. Raise your hand in this meeting or write your question in the chat and we will answer them. At Greater Vision, our intake team is here to help guide you through the process of becoming a family home health aide. If you have questions about eligibility, the application process, or service authorization, you can reach out to Yolanda Harrison, our intake coordinator. You can contact her by phone at 407 Greater extension 118 or on her mobile at 407-921-1267. You can also email our intake team at intake@gvhcs.com. We also have a dedicated support team ready to assist you every step of the way. Our team includes experts in human resources, nursing, compliance, and IT support. Whether you have questions about the application process, training, or certification, our team is here to ensure you have everything you need to succeed in this program. Thank you for taking the time to learn about the Family Home Health Aide opportunity. We look forward to helping you on this journey supporting you in your role as a caregiver and ensuring the best possible care for your loved ones. If you have any further questions, don't hesitate to reach out.